Imagine this. You go to a neurology consult about recurring headaches. The doctor talks through options quickly, medication adjustments, an MRI, maybe a nerve block, and you nod because they're using all the right words. You leave with a card and a list that feels vague. Reassess in 6 weeks and consider imaging if worse. An hour later, you realize you don't actually know who's ordering the MRI, when you should expect results, or what to do if symptoms spike tomorrow. You feel stuck, anxious, and honestly, frustrated.
Hi, I'm Jessica Tonya, Nurse Jess, and today I'll give you a practical playbook so your specialist visits stop feeling like a scavenger hunt. By the end of this episode, you'll know exactly what to bring, what to say, and how to leave with a clear, actionable plan. Let's separate medical fact from fiction and make sure you walk out knowing the next steps.
Quick educational note. Nothing here replaces professional medical advice for your unique case. This episode is about communication and safety, how to get clear answers and contingency plans from your specialist team. If you're in immediate danger or your symptoms are severe, call your provider or emergency services right away. The one-page specialist visit checklist and the scripts I mention are available in the show notes if you want to download and print them before your appointment. First, what is a specialist visit for? Specialists help diagnose, recommend targeted treatments, or weigh advanced procedures when primary care reaches its limits. Typical flow, you check in, a nurse or assistant confirms basics, you and the specialist discuss the problem, they perform an exam, and then they recommend a plan, sometimes immediate, sometimes conservative. The key difference from primary care is speed and focus. Specialists often have limited time and are aiming to solve a targeted issue, not manage everything at once. So, what should you bring? Keep it simple and useful. Bring an up-to-date medication list with doses and how often you take them. Bring a concise timeline of the problem, when it started, what helps or worsens it, and what you've already tried. Bring photos if symptoms are visible, and copies of recent imaging or reports when you can. If the imaging is at another hospital, bring the CD, a copy of the report, or ask your primary care to transfer records ahead of time. And bring a notepad or your phone ready to record next steps. A few quick tips for records. If your records are in different systems, ask your primary care's office to send a brief summary and essential imaging to the specialist a day or two before. If that's not possible, bring a short one-page timeline and the names and dates of tests. Specialists can often pull key details from that faster than hunting through multiple portals. Next, building a 60-second problem summary. This is gold. Structure it like this. 1 sentence describing the problem, 1 sentence for the timeline and what you've tried, 1 sentence for your goal. For example, I've had left-sided headaches daily for 3 months despite trying a low-dose preventative medication and OTC pain relievers. They're worse with bright lights and sometimes cause nausea. My goal is to find a treatment that reduces frequency and lets me work full days without interruption. Practice it out loud once or twice before you go and bring it written down. Now, let's get to the exact scripts. These are short, adaptable templates. Treat them like dressing options, not instructions to read verbatim. 1 sentence opener. Hello, I'm here for new care for my left-sided headaches. My main goal today is to reduce how often they happen so I can work and care for my kids. 2-line priority question to guide the visit. What do you see as the most likely cause, and what are the options to try first? And a short script to request a clear decision and timeline. Can you recommend one next step today? Tell me how long to try it, and what to do if it doesn't work or I get worse. If you need the specialist to act, ordering a test, prescribing something, or arranging a procedure, use this line. I want to make sure we have a clear plan. Who will order the test? When can I expect results? And who should I contact with concerns? That helps avoid the classic "it fell between clinics" problem. Let's unpack common recommendations and what they usually mean in practice. If a specialist says, try conservative care, that often means start or optimize physical therapy, lifestyle changes, or medications first, usually with a defined trial period, like 4 to 8 weeks. Reassess in X weeks should come with a plan, what to look for during that time, and what to do if you worsen. Consider procedure generally means it's an option, not an immediate requirement, and should include risks, benefits, and alternatives.
If any recommendation sounds vague, ask for the timeline, the goal of the intervention, and the measurable outcome they expect.
Coordinating care. Ask early who's responsible for what. Use a line like, "Who will order and schedule tests, and will my primary care be copied on the plan?" If the specialist says they'll follow up only if something changes, ask for a plan B, how you or your PCP can get a short check-in if needed. If system barriers prevent direct transfer of records or scheduling, ask for a brief patient portal message template you can send from your PCP, or request a single-page summary from the specialist to share with your PCP.
Safety cues and red flags. Know them before you leave. Escalate immediately for new or worsening symptoms, like sudden numbness or weakness, sudden change in speech or vision, chest pain, shortness of breath, signs of infection, like fever with a wound, or severe uncontrolled pain. If the specialist's plan lacks a contingency, for example, no clear instructions about what to do if symptoms spike, ask them to add one now. That's part of leaving with a safe, actionable plan.
When should you ask for a second opinion? If a recommended intervention is high risk, irreversible, or if you feel uncertain after a visit, ask. You can say, "I appreciate your recommendation. For my peace of mind, I'd like a second opinion before moving forward. Can you recommend a colleague, or would you support a referral?" Framing it as seeking clarity keeps relationships positive and professional.
Closing the visit, use a quick checklist before you stand up. Confirm the main decision, who orders tests, any prescriptions, the timeline to expect results, how you'll get results, and a contingency plan if symptoms worsen. Say out loud, "To confirm, my next step is X, the test will be ordered by Y, I should expect results in Z days, and if I have A or B symptoms, I should contact C." That single sentence often surfaces missed responsibilities.
A few practical notes that address real-world limits. If your appointment is short, use the 60-second problem summary up front and the 2-line priority question to steer the visit. If records can't be transferred, bring photos, a concise timeline, and ask for a follow-up via patient portal or a quick phone check-in. If insurance or scheduling limits options, ask the specialist what a reasonable short-term plan looks like while you pursue long-term options. Before we wrap up, 3 concrete takeaways you can use tonight. 1. Write a 60-second problem summary and put it on paper or your phone to bring into the visit. 2. Use the 1-sentence opener and the 2-line priority question to steer the appointment toward a clear next step. 3. Always close with a 1-sentence confirmation of who will do what and when. Tests, results, and contingency steps included. Those 3 actions alone will cut confusion and improve safety. The downloadable 1-page specialist visit checklist and the exact scripts I talked about are available in the show notes. Print it or screenshot it so it's easy to grab before your appointment. And remember, these scripts are templates. Practice them once, adapt the language so it's yours, and if it helps, bring a friend or caregiver to support asking questions.
If you found this episode helpful, please subscribe so you don't miss future patient-centered explainers. If you have an anonymized specialist scenario you'd like me to cover, send it through the contact link in the show notes. I'll anonymize details and use it to build future episodes that answer real patient questions. Until next time, stay informed, stay compassionate, and always put safety first.